Thank you for joining us for the Geographic Atrophy, Knowledge, Hope, and Help. I'm pleased to join you all tonight. I'm Kira Baldonado, Executive Vice President at Prevent Blindness, and I'll be moderating this forum. I'm a middle-aged woman with strawberry blonde hair and wearing a green flowered shirt and green glasses. So today we will be learning about geographic atrophy, understanding the patient experience from two individuals living with geographic atrophy, and we're going to learn about resources available for those living with GA. I would like to take a moment to thank Apellis, Astellas, as well as Johnson & Johnson for sponsoring this event and making this educational session possible. And now I'd like to introduce our first presenter for this forum, Dr. John Kitchens. Dr. Kitchens is a retina specialist from the Retina Associates of Kentucky. Dr. Kitchens will provide an overview of geographic atrophy for us. And we'll have a question and answer session after hearing from all the panelists today. Please note that the information shared in this webinar is for educational purposes only and is not intended to serve as any medical advice or endorsement of any specific treatment or product. Always consult your healthcare provider for personalized medical guidance before making any decisions regarding your health or treatment options. We encourage you to reach out to a qualified medical professional who can assist you with your individual needs. And with that, I would like to hand the presentation over to Dr. Kitchens. Welcome, Dr. Kitchens.
Thank you, Kira. My name's John Kitchens, and I'm a retina specialist in Lexington, Kentucky. I am a 52-year-old who has a gray beard and short cropped thinning hair, and I'm wearing a white sweater this evening. I'm in my office where I have lenses from various cameras, and I really appreciate patients like Pete and Diane. Pete is a photographer and loves photography, and it is near and dear to my heart. And understanding some of the principles of photography really can help you better understand macular degeneration and geographic atrophy. When we think about the eye, you want to think about the tissue that's affected by geographic atrophy, the retinal and the tissue behind the retina called the retinal pigment epithelium, like the film of a camera. The front of your eye serves to focus light onto the back of the eye, and it is that tissue, that nerve tissue in the back of the eye, that is affected by age-related macular degeneration. And just as the name suggests, age-related is a disease of aging that affects the back of the eye. The macula is a part of the retina that really affects the center vision. It's about the size of the tip of an eraser. And degeneration means that it is a degenerative process. Many people on this call have heard about age-related macular degeneration, or as we abbreviate it, AMD, and many people are affected by AMD. Traditionally, we think about AMD as being two distinct diseases, the wet type of macular degeneration and the dry type of macular degeneration. And in many cases, you're told that the dry type of macular degeneration is the good type, or the type that doesn't cause vision loss, whereas the wet type is when you develop abnormal blood vessels in the back of the eye that can bleed and leak and are fortunately treatable, but if left untreated, can cause significant vision loss. Geographic atrophy is a distinct type of dry age-related macular degeneration where you have loss of a tissue in the back of the eye that leads to degeneration of the retina. Let me share a few slides to help you better understand that tissue and how that loss affects patients, how we identify the loss in clinic, and how we can monitor the progression of the loss of that tissue. Great. So here we can see, this is my title slide that says Understanding Geographic Atrophy. This first image shows the eyeball, and the eyeball here is in cross-section, where you can actually see the front of the eye, which is the cornea, the lens, which traditionally we think about developing into a cataract, and then the back of the eye, which is referred to as the retina, the orange tissue that lines the back of the eye. And we will zoom in here and look specifically at the very back of the eye, the area called the macula. And the macula is the part of the retina that is responsible for your center vision. This is traditionally the part of the eye that sees for reading, for identifying patients or friends and family's faces, and other really valuable activities of daily living like driving and whatnot. The part of the retina, as we turn it to the side here, that's most important is the outer part of the retina. This area is called the photoreceptors, and these photoreceptors, as we'll zoom in here, actually sit on a tissue layer called the RPE. The photoreceptors are what sense the light, and the RPE is what keeps those photoreceptors that are incredibly metabolically active working and functioning. I like to think about the retina like it being a race car. RPE is the pit crew. The RPE keeps the photoreceptors running and keeps them functioning. And unfortunately, when patients develop geographic atrophy, they lose those RPE cells, and shortly thereafter, they lose the photoreceptors. And once those cells, those photoreceptors are gone, you cannot get them back. That's why it's so important to understand this disease and to identify this disease before it involves the area of center vision. So, how do you know if you have geographic atrophy? Well, many patients with geographic atrophy are going to be asymptomatic, meaning they don't know they have the condition. If the geographic atrophy does not involve your center vision, oftentimes you may not realize that you have it developing. Most patients will be identified as having geographic atrophy in this situation by a routine eye examination. That's why it's so incredibly important to go to your eye doctor as you get older to have a dilated ocular examination and make sure that the doctor images and looks in the back of your eye to identify early signs of geographic atrophy. Once you're diagnosed by an optometrist or an ophthalmologist as having geographic atrophy, they're going to likely refer you on to a retina specialist. That is an ophthalmologist who has additional training in managing diseases in the back of the eye. We are specialized and have additional equipment that can help identify the geographic atrophy. One thing we may do is take pictures of the back of your eye. This slide actually shows on the left-hand side a color photo of the back of the eye. It's a beautiful orange color when you look at the retina. The optic nerve is a circular area that you can that is on this slide, and that's where all the information comes in and out of the eye, as well as blood vessels come in and out of the eye. But the important area is the area of center vision that's just to the left of that round optic nerve. The picture on the right is a picture that we oftentimes get to identify geographic atrophy called fundus autofluorescence. This is a black and white image of the same area in this same patient's eye. And what stands out here is an area of dark that you can that is there that actually is the area of tissue loss. And I will zoom in on that. And you can see here the area of dark in the autofluorescent imaging. There's a red dot that I've utilized to identify the area of center vision. So this patient may come in and still be able to see 20/20, but they might miss parts of words because as they're trying to read, they can see a letter or two letters, but then as soon as the word falls into that area of darkness, they lose that ability to see that word. So if they're looking at a word like encyclopedia, they may see the first half of the word, but lose the second half of the word. And it can be incredibly frustrating. They can also lose cars as they're driving. When the car enters into that area, that can become a blind spot. They no longer see the car, and it can be very, very frightening. This is one of the major tests that we use to identify geographic atrophy and track geographic atrophy. Another test that we obtain oftentimes in patients who have geographic atrophy to help us identify whether you have atrophy or not is called an OCT scan. What's on the slide here actually shows an OCT scan from a patient several years before they developed geographic atrophy on the left-hand side, and then once they develop geographic atrophy on the right-hand side. And you can see these scans, when you're looking at them, they look fairly similar. But in actuality, the slide on the right shows significant loss of retinal tissue and loss of vision in the areas of the geographic atrophy. I'm going to zoom in on the scan to the right, and I'll highlight a few areas. This is an enlarged area. This is a cross-section of the patient's retina that is suffering from geographic atrophy. There is an arrow now pointing to the area of center vision. And fortunately for this patient, they still have some preserved RPE in this area of center vision. So it might be that this patient can actually see 20/20 on the chart, but their functional vision will be much worse. I'm now going to highlight in white an area of healthy retina where there is intact photoreceptors. Next to it, in an area in red, and I'll identify two areas of red, there are areas of loss of retinal tissue. And the retina actually thins in these areas, and you lose the photoreceptors that we can visualize on the OCT in the areas of healthy retina. So this is a patient that might see well centrally, but off to either side, they lose vision. Next, I'm going to show you progression of geographic atrophy in a patient over 3 years. The first image on the left is a patient when they presented with geographic atrophy, and it's not involving the center vision. The patient didn't even realize they were having trouble. To the right is another black and white autofluorescent image showing progression of that geographic atrophy over a year and a half. And you can just see how much this area progresses. We'll progress on, and we'll see another year and a half later. Now the geographic atrophy is involving the entirety of the area of center vision, and the patient has lost significant vision. And one of the really tough things about geographic atrophy is it is a bilateral disease that oftentimes will present with similar features in both eyes. So patients will be losing vision in both eyes simultaneously. What does a patient see? This is a mock-up example of the progression of the scotoma or loss of vision that a patient will see as the geographic atrophy progresses. They might notice gray or cloudy vision in and around their center vision. And as they progress, that scotoma darkens and can involve more of the center vision. So what can we do to try and slow down geographic atrophy? Well, about 2.5 to 3 years ago, we had the first approved treatment for geographic atrophy. Shortly thereafter, we had a second approved treatment for geographic atrophy. These treatments inhibit an overactive immune system called the complement system and can slow down the progression of geographic atrophy by about 20% at 2 years. They are administered as injections into the eye. Now, fortunately, we're able to numb up the eye, and you don't have to watch the injection come right into the center part of the eye. We give it through the white part of the eye, and it goes in through the side, but it does go into the eye in a very small needle. The medicine then works over a period of 1 to 2 months, so the injections have to be repeated every month or two. And it can slow down that growth of the geographic atrophy, once again, by 20% at 2 years, and perhaps even further at 3, 4, and 5 years with treatment. But you have to stick with treatment. The geographic atrophy will get worse, but it will just get worse 20% slower, as we'll tell patients. Many patients will ask about vitamins or alternative treatments for geographic atrophy. And frankly speaking, the results about the ARADs or age-related eye disease vitamins that you see in the stores are conflicting. There was a study about a year ago that suggested that potentially the ARADs vitamins could slow down the progression of geographic atrophy into the area of center vision. Various other studies have attempted to duplicate these results and have been unable to. So I think the jury's still out as to whether the vitamins actually have an impact on the progression of geographic atrophy. Some questions you may want to consider if you've been diagnosed with geographic atrophy for your doctor would be, how close is it to the center vision? If you've seen your patient on more than, or your doctor on more than one visit, you might want to ask, how fast is it growing? What are the recommendations for treatment? Can I wait to have treatment, or should I start the treatment now? And what are some sites and sources of information that could help me better learn about the treatments for geographic atrophy? I think there will be a time at the end of this for questions and answers, and I look forward to answering those for you. Kira, I'm going to turn the presentation back over to you now. Thank you.
Thank you so much for that presentation, Dr. Kitchens, and I appreciated you explaining, how things can be happening in the eye and it's not even noticed yet. The importance of connecting with an eye care provider to learn what's happening and then progress and discuss what treatments might be right for the individual. And touching on those areas, I know that was a large part of the questions that came in as we were getting ready for this webinar. Good information. I look forward to the Q&A later. Now, I would like to welcome Julie Grutzmacher, Director of Patient Advocacy and Population Health Initiatives here at Prevent Blindness. She will lead a discussion with Diane Marshall, who is an individual living with geographic atrophy and also a graduate of our patient engagement program. And then also we have Pete Poulsen, who is also a graduate of our patient engagement program, a retired business communication coordinator, and then also an individual living with GA. They will both share their personal experience and really share a lot of great information for all of us. Thank you. I'm going to turn it over to Julie.
Thank you, Kira. Hello, everyone. My name is Julie Grutzmacher. I am a white woman in my early 40s. I have long brown curly hair, and I'm wearing a green blouse with various patterns on it. I am so happy to be here with Diane and Pete tonight. I met them through the Aspect Patient Engagement Program at Prevent Blindness, which is an advocacy and storytelling program that we've had we started from scratch, and it's been around for about 5.5 years. So Diane and Pete, welcome. To start us off, I would love to hear, let's start with you, Pete, about your experience with GA. Both of you have geographic atrophy, and I'd love to hear just a little bit about the time kind of leading up to your diagnosis, what was going on in your life, maybe a little bit about the symptoms you were having, anything you want to share. Pete, let's start with you.
Thanks, Julie. I'm a 78-year-old white man with gray hair and a white mustache wearing a royal blue shirt in my home office. I guess I learned about macular degeneration many years ago when both my mother and my aunt were diagnosed with MD, and I saw what the results were in their life. That was long before we knew the difference between wet and dry. But at that time, I did see an ophthalmologist who saw a few deposits in my eyes and suggested keeping an eye on them through the years. Then about 10 years ago, I guess it was, I noticed a difficulty. We were in Disney World. I was going into a dark theater with my daughter and her children and discovered I couldn't see a thing and had to be guided in there. And I started seeing more problems in my vision, while I was out in the light and especially when I was in dark areas. Then about 6 years ago, an optometrist suggested that I go see a retina specialist. Now, he had diagnosed me for the first time with geographic atrophy. And that was the first time that I had even heard of geographic atrophy or wet or dry macular degeneration. And unfortunately, he told me that I had advanced dry macular degeneration, which is known as GA, but I was in the early stage of the GA. And he used a term that I've still loved telling people. I had a donut hole. What I've now learned is non-foveal GA. So I had that center vision in the center where I was 20/20, 20/30, 20/40. I held up in there, but I started losing around my central vision. And I noticed that I was having more problems seeing and had some other problems. He told me that no treatment was available at all, but there were some possible trials, but I didn't work out for them. And then he said that I had about 5 years before I would lose my central vision, or before I'd lose what I have in the center that Dr. Kitchens talked about. And then about 4 years ago, because of my loss of vision, I had to stop driving. And then it was in 2023, as was mentioned, that the FDA approved treatments to slow the progression of GA. And I started getting shots in April of 2023, just a short 2 months after the FDA approved it. And I've been getting shots every 8 weeks in both eyes, a series of 15 rounds so far. And the doctor says he thinks it's slowing it very much, but I really can't tell because I have no idea how it would have progressed. That progression isn't linear and it comes on slowly. So I don't know, but he says I'm doing very well for the time I'm in. And since I've started those shots, I've extended that 5 years out further for losing my central vision. I'm still functioning fairly normally, but with several areas of difficulty. I need extra light in dark areas, a lot of extra light. My vision is very hazy in bright light. I tell people it's a foggy day almost all the time. I have difficulty seeing faces and recognizing faces, and I'm missing areas along the side, those blind spots that Dr. Kitchen talked about. And I have difficulty with low contrast and with colors. I do almost all my reading on an iPad or an iPhone, and often on white letters on black, which seems to make it a little easier for me, and much larger fonts. So I'm still adjusting every day, but I'm hopefully slowing down the progression.
Thank you very much, Pete. It was so helpful to hear just a little bit more about the specifics of what changes you experienced leading up to that time in your life. So Diane, how about you? You want to share a little bit more about the time leading up to your diagnosis, what was going on in your
Yes.
life?
I'm a 79-year-old white female. I'm 5'3". I have brown eyes, graying hair. I do wear glasses, and I'm wearing a blue blouse. I was about 54 when I went to my optometrist for a regular checkup. And he said, I'm seeing something in the back of your eye, little deposits called drusen, and I'm concerned. So he sent me to a retinal specialist. The retinal specialist took many photos of the back of my eye and confirmed that I had early stage dry macular degeneration. He told me not to worry because by the time it became a problem, they would have a cure. Unfortunately, he was wrong, but my vision stayed very good, about 20/20 for many years until I was about 65. And then I noticed things became more difficult to read, but my optometrist was still able to make corrections with glasses. And then when I was 70, it was clear that it wasn't clear anymore, and things were blurry and very difficult to read. And so he told me that I had geographic atrophy, and it affected much of my life. I did try 2 of the FDA-approved treatments to help slow down the progression, but unfortunately, I started them too late because my vision had already progressed to advanced dry macular degeneration.
Thank you, Diane. Diane, let's start with you for this next question, just a little bit more. And some of this has been touched on by both of you of, time needed to adjust to dark rooms, blurriness, low contrast. But can you share a little bit more about, the day-to-day, how, the impact of GA on your day-to-day life?
Well, obviously, it has had a major impact in my life. I had to give up driving, which of course limits your freedom to some degree. And then I had to give up photography, which was a love of mine, as with Pete and Dr. Kitchens. So that was a big loss. Doing things that once were so easy were not so easy anymore. Simple things like putting the plug in the wall or turning on the stove for the temperature. Going to the ATM was a major challenge. I didn't know where to put my card, my checks. So that was very challenging. Not being able to see my own face in the mirror and often seeing people walk toward me and I wasn't sure who they were. That was also difficult. Filling out forms at the doctor's office became impossible, and I had to have other people help me do that. So it affected me both physically and emotionally. At times, I felt very unnerved, not sure what to do, where to go, how to find my balance again. I was often feeling a little scared and not sure what to do again to find my balance. So it was a daily challenge. Anything you can imagine that you do with your eyes was difficult from that point forward.
Mhm. Thank you, Diane, and thank you for just sharing more of, the particulars, the day-to-day things that, can be taken for granted, and how that changes and shifts with GA. Pete, how about for you? Anything additional? You mentioned some things earlier. Any additional things you'd like to add?
Very, very similar to Diane, I think. I had to stop driving. I had to stop my photography. I had to stop bicycle riding. I had a lot of loss of independence and freedom. And to be completely honest, I have periods of extreme frustration and anger when I can't see or do something. I've learned to ask for help and depend on others a lot. I have difficulty seeing the faces, as Diane said, navigating crowds, especially airports and places like that, and seeing in restaurants, very hard in restaurants and dark hallways, reading menus. I have to carry a light with me everywhere I go. And I have a difficulty explaining to others what I can and can't see because it often changes depending on lighting and the conditions I'm in. I've found opportunities to learn about other types of vision impairments and to meet new people, both online and in person, who are both blind and have low vision. I'm learning about all possible technologies and supports for low vision now, while I still have fairly good central vision. And finally, I have a new vision, if you'll excuse the pun, and a hope for the future. I've started a new in-person low vision support group in my community, and we already have over 20 members from blind to still fairly good function seeing. It's really a great opportunity to help others.
Absolutely. Thank you, Pete. Thank you for touching on some of those important resources and I also really appreciate that you mentioned the anger and frustration that can come, because it's a process, it's an adjustment. It is not an easy thing to integrate vision loss into your life. It takes time and asking for help and finding resources. And so on the topic of resources, Pete, you mentioned support groups and technology. Diane, is there anything additional that you want to share about what were some of the most helpful resources to you in your journey?
First of all, I want to say that dealing with geographic atrophy is, as Charles Dickens said, could be the best of times and the worst of times. It is a challenge. I'm not going to downplay it. To lose your vision is a challenge, but there are so many resources out there that you can choose to help you. Some of my favorites are Apple. I use my iPhone, I use my iPad, and they even have a direct line for accessibility help. You can have whatever you need read to you, you can dictate, and that's important. As an avid reader, it was difficult because I couldn't read anymore. And there are sources like Audible, where you can always listen to audiobooks. You can also get them through Libby, which is an online service through your library, which is free. I got Ray-Ban Meta AI glasses, which are great. I just, put them on and say, hey, Meta, read this page to me, and it will read it. And the other day, I just on a fluke, I said, I'm going to hold this jar of mayonnaise because I can't read the expiration date. And I just said, hey, Meta, what's the expiration date? And it found it right away and read it to me. So there are many things out there that can help. Magnifying glasses, digital magnifying glasses. There are also support groups, which I greatly encourage someone to join. I became part of the Advocacy group, which led me into many other areas. Bright Focus has chats, and Hadley will help. There's the Braille Institute. There are so many different forms where you can join with other people. You don't have to go through this alone. You might feel alone, but when you connect to other people, you'll learn so much about how they make it through difficult times and give you little clues about things that'll help make life easier for you.
Yeah, I'm really hearing the importance of community and connecting with others who just get it and who can also share additional resources. Pete, anything to add to that? Any other resources that really helped you?
At the risk of repeating, I mean, I agree with Diane on the support groups. Bright Focus and Prevent Blindness have been tremendous groups. The Fighting Blindness Foundation, local groups. Recently, I attended a large White Cane Safety Day, which there's several of during White Cane Safety Month, which was this month of October. I've been meeting and learning from people with all types of vision issues, and there's something you can learn from each one of them. I'm definitely learning the technology tools like the iPhone that she talked about, Uber. I'm using Uber a lot for transportation. I carry portable lights. I have two pocket flashlights, one bit brighter than the other that I carry at all times. I have a table light that I take into restaurants. And I've done a lot, continued research on GA and low vision, both on the internet and in books.
Excellent. And, we know that sometimes, I think in probably sometimes some of these devices might be covered by insurance, other times not. Sometimes they can be pretty expensive. What has been your experience with getting access to some of them? The magnifiers, the meta glasses, the huge difference in costs there. But anything you want to share? Is there financial support out there that you're aware of for these devices?
Diane may know more about that than I do, but I've got a low vision specialist that's working with our support group, and she has indicated there's a lot of those opportunities out there. I haven't gotten to the point needing most of them. And without doing a commercial here, the Meta glasses are much, much more reasonable than all of the other resources that have been out there beforehand.
Great. Great. Thank you.
I think
Diane?
I think there may be resources out there. I have insurance and they do have VPS. And if you qualify because your vision loss is at a certain level, I think it's 20 over 60 or legally blind, they will pay for many of the devices. Also, the Braille Institute, if you connect with them, they have resources to help people.
Oh, great. Even more, even besides Braille, they have
Yes.
some technology devices.
Yes,
Great.
they work with people who have low
Excellent.
vision and they have many devices.
And Lighthouse is another one.
Yes.
Okay, wonderful. So, let's start. How about we start with you, Pete, on this question? What advice much of this came out in the conversation, but what advice would you give to someone who's newly diagnosed with GA?
My first advice is to study and learn all you can about GA and living with vision loss. Definitely go see a specialist, a retina specialist or an ophthalmologist, and get multiple opinions if you need it. And then start your treatments as early as possible if they're recommended. They can slow the progression sooner. Diane talked about that. Join online support groups like we both mentioned, and find a local group for in-person support, not only with people with GA, but with all kinds of vision problems. Meet others with low vision. Remember that you're really not alone in this, and your life will change, but it's not over. Be positive and learn to adopt.
Thank you, Pete. Diane, how about for you?
Something that's very important to me, and I give advice all the time to people, find a retinal specialist who you connect with, who you know cares, who's listening to what you're saying and not brushing you off. I do understand that they're busy and often they may not have the time. You need to be your own advocate and ask for the time if you don't understand something. And I also think it's important that if you're not feeling right, you tell your retinal specialist if you're not feeling right physically or emotionally, because he or she might have some resources. And like Pete, I think it's important to do your own research, because then when you go into the doctor, you're forewarned about, things, and you've learned enough that you can question. And I also advise you to find people to connect with and be gentle with yourself. This isn't easy. And being angry at yourself because you can't see something is not okay. You need to understand this is a process and you will get through it. It is a challenge. My motto is accept and adjust, and you can and you will.
That's really beautiful. Accept and adjust. Thank you both so much. Is there anything else that I haven't covered or asked tonight that you wanted to share? Any additional information?
Looking at something like this, I want to see more public awareness of what GA is. I'm still finding most people have no idea what GA is. Some of the TV commercials for the current FDA-approved treatments have helped spread that word a little bit. But I definitely have hope that there'll be a cure or something that will stop it or eliminate in the future. Maybe stem cells or treatments or surgeries or something.
Absolutely. Yes. Yes. And hope, Diane, speaking of hope, thank you, Pete. What hope do you have for GA and for the future?
My most important hope is that they find a cure before it even becomes GA in somebody's, eyes. That's my biggest hope. The other one is that people will join groups and not go through it alone, that people will do the research to find out what's important and to just hang in there and do have hope, because there's so much coming down the line right now. It may not be okay for me, but I think within the next 10 years, there'll be amazing treatments.
To add to that, many years ago, my ophthalmologist told me that there would not be a cure in my lifetime. Now I'm beginning to think that maybe I'll live long enough to see a cure, if not for me, for others.
Yes, yes. Thank you both so much. I heard one patient recently say something along the lines of, hope is the only prescription that I never let run out. Thank you both so much for joining and for sharing your perspective. And at this time, I'll turn it back to Kira.
Thank you, Julie, for leading that insightful conversation, and to Diane and Pete for sharing your stories, your experiences, your feelings, but also the resources, your recommendations, and your hopes for those living with GA. One of the important pieces that came out of your discussion for me was all of the different resources that you shared. And so I'm going to share a few more with the audience today. And these are resources that we have both on the Prevent Blindness website, but also some of those that Diane and Pete shared with us. So I'm going to make sure that I have those on the slides. We're going to share this information certainly with all of you afterwards, so you can come back again and again and find out more. For those of you living with GA or care partners, or those that just want to learn more about geographic atrophy, we do have information on the Prevent Blindness website on our geographic atrophy page that has an explanation of what GA is, downloadable fact sheets both in English and Spanish, and also recommendations around questions you may want to ask your doctor about, if you are diagnosed, how you can be an active partner in your care. So we have a QR code here on the screen that you can scan, but also certainly the web address is on the webpage as well, and we'll share that with you afterwards. Another resource that was mentioned was the Prevent Blindness Patient Engagement Program. We call the program Aspect. So this is a program that provides training for individuals living with vision conditions, eye diseases, vision loss, blindness, or at risk of, as well as allies. So this may be individuals who are supporting those with vision loss. It can be individuals in different career positions, medical students, all kinds of individuals. You just want to learn more about how to be a better partner or how to be more engaged as an individual with vision loss or blindness. The Aspect program provides the training for that. You get to meet other individuals with a range of different conditions and diseases. And you heard Pete say that there's lots to learn from people with a range of different vision disorders. There's always something to learn. You certainly have the opportunity to build a community with the individuals in this program. You come to understand how to shape your own personal story and leverage that story to find positive change in your community, in health practice, and research, and changing policy, whatever component of advocacy that's important for you. It may just be talking with your insurance company better, or it may be going to Capitol Hill and asking for legislative change. The training that you get in Aspect is grounded in storytelling, and you will come to learn the power of your own story for making change. And so we do have the QR code for Aspect, and we'll share the link for that as well with you. Another resource that we offer at Prevent Blindness is called Living Well with Low Vision. And the goal of this resource is to help people educate themselves about vision loss, how to meet the daily challenges that come from vision loss or blindness, and provide a range of resources from personalized guides around living with age-related macular degeneration in all its forms, including GA, as well as those living with diabetes-related eye disease, and also support specific to care partners and professionals and how to be the best person there, the best experience, the best engagement for people with vision loss and blindness. You have opportunity to connect to support groups, and we've already heard from Pete and Diane how important those support groups are, and also has a transportation service finder as well as a clinical trial finder, because we're all very engaged in wanting to see new treatments, additional options develop for patients. So you have a chance to be engaged in that way. And then I did have a chance to capture a few of those resources offered by Diane and Pete. Thanks for these great options. And so I include here on the slide the Apple accessibility support. They have both a phone number as well as a website available. The phone number is English only, so if you need another language, please access that on the web. But they can help you understand how to better use the accessibility functions on your Apple devices. I have a link to learn more about the Meta AI glasses, as well as another resource we've talked about earlier called Be My Eyes. Be My Eyes is an app that lets you point your phone at anything, and it will connect you to a volunteer who will help you read what you're pointing your phone at through the camera function. I did capture the suggestion of the Libby audiobook app, and so these are the audiobooks that you can get from libraries. This is free, and so it pulls from libraries all over the country. Another great resource that Diane shared with me earlier is called GoGo Grandparent. And so this is a phone number that you can call to arrange for transportation to medical appointments. And so it's all on the phone, very simple. It is a paid service, so please be aware of that. And then Pete had mentioned using Uber. Uber does have something called Uber Simple, which puts the content in a much cleaner format, larger font, easier to use. So that's another resource for you as well to consider. So all of these with the links or the phone numbers will be on the slides as we send them back out to all of you. And welcome back, everybody. So thank you for your presentations to help us understand GA a little bit better, Dr. Kitchens, as well as Diane and Pete for sharing your stories. But there's a little bit more we want to know, some questions from the audience. So Dr. Kitchens, I'm going to start off with a couple that we have for you. Can you tell me, we've only spoken about GA tonight, but is it possible to have GA with other vision conditions such as wet AMD or glaucoma or cataract? How does that all work?
Yeah, Kira, it's absolutely possible to have both. And in fact, about a third of patients with wet macular degeneration will develop geographic atrophy. And over years, patients with geographic atrophy can also develop wet macular degeneration. So in these patients, it's possible that they might end up on treatments for both, which is very intensive. I love how Diane and Pete talked about their conditions and treatment. I think their attitude is ideal. You want to get these treatments for geographic atrophy early, before it's involved your center vision, before you're losing vision, because at that point you're fighting an uphill battle. But you can indeed have both.
Oh, that's good to know. So help us understand a little bit more about the progression of GA. So we know it's important to get treatments early. But getting treatment is a big decision for folks. So help us understand a little bit about progression of GA, and sort of the timeline we're working with to make those treatment decisions.
Boy, Kara, it's really hard for us to predict progression. Everybody's geographic atrophy progresses at a different rate. And that makes it really tough when we first see a patient with geographic atrophy to know exactly what to recommend. Now, if a patient comes in and they've lost vision in one eye to GA and they have GA in the other eye that's threatening the area of center vision, those are the patients that we might say, hey, listen, I think it's best to go ahead and start treatment at this point. But if a patient shows up with just a small area of geographic atrophy that's far away from the area of center vision, in many instances, you may say, let's see if this is going to be the type of GA that grows or doesn't grow. And we might say, let's watch this and see you back in 3 or 4 months and see if it changes. You can be surprised. Sometimes patients will have GA that doubles in size in a matter of 6 months. And then you really feel an urgency to treat patients in that situation. And other people, the GA will remain relatively static. In some people, GA is going to grow away from the area of center vision. And in other people, it's going to grow towards the area of center vision. Some people, it may grow for a while and then it may stop. It's just very, very unpredictable.
So with GA, is there a family history component of that, and the patterns of growth in the family history? Does it tend to follow from one person in the family to the next? Is that a possible indicator?
Yeah, Kira, so there definitely is an inherited risk that comes with macular degeneration and geographic atrophy. We see patients commonly that come in and say, I want to get something done before I lose vision like my mother or father lost vision from macular degeneration. The number one risk factor, however, for geographic atrophy is getting older. So that's why it's so important that patients, as they get older, get a routine dilated eye examination to make this diagnosis early. It's possible you may have no signs of GA 1 year, and a year later, when you have a follow-up examination, they see signs of geographic atrophy and then refer you on for an evaluation and treatment with a retina specialist.
Okay, thank you. And I'm going to open up this question to anybody. But one thing that we didn't get a chance to dig into just yet is understanding how to take part in a clinical trial. So there's a lot of great research happening around GA. And so, if one treatment doesn't work for you, maybe you want to understand how other treatments are being formed and may want to understand clinical trial participation. So Diane, Pete, from your perspective, how do you find opportunities like that? Or Dr. Kitchens, how do you guide patients when they ask about clinical trials?
My retinal specialist, whenever I'd go in to see him, I'd say, what's available? What do you think would possibly help me? That's where I start. But being part of the community, there's so many people in these groups that are aware of different things, and they'll inform me, hey, have you looked into this one? What about that one? And then there's a website, clinicaltrials.gov. You can go there and they have a list of all the different kinds of clinical trials available.
Kara, I would add that when you're in a clinical trial, you should not have to pay for being a part of that clinical trial. So any clinical study where they say, oh, you can be a part of this and it's only going to cost you $5,000 a year to be a part of this very innovative clinical trial, you should turn and run the other direction. All of the legitimate phase 2 and phase 3 clinical studies are going to be funded by the drug companies that are investigating the drug, and you should not have to pay to be a part of that. And in fact, in many of the clinical studies, and in most of the clinical studies, you will pay nothing because your insurance won't be charged for the treatments. The study, the drug company that's studying the drug will cover everything.
You'll often cover transportation too. And that's an issue with people that I've talked to, especially on the different online support groups, that I'm very fortunate to live in a community with 3 major hospitals and a lot of care and a lot of retina specialists in the area. People I know that I've met that live where it's an hour and a half, 2 hour, 3 hour drive to get it becomes much more difficult. So check around your area and what's available.
Thank you. And I'm glad you mentioned some of the warning signs around scams. Certainly when you're when you're living with GA and looking for solutions, it's emotional time for some. And you need to keep your eye out for those warning signs. So if somebody does ask you to pay for something, like you said, run the other direction. Check it out with trusted sources. And like you said, Diane, talk to your retina specialist to make sure it's an approach to consider. All good information. Diane and Pete, I wanted to get a little bit of an understanding or explore how living with GA has impacted your family, your loved ones, your friendships, your social network. How have they evolved with you as you've been living with your GA?
Well, since unfortunately my family has all passed away, I have lots of friends who I explain very clearly to what I need. And it has been challenging. I do have one person who at least once or twice a week will take me to the market, will take me to medical appointments, because I can't fill out forms, and often I can't even find the room number. So having somebody there is wonderful. And my friends have been really understanding about what's going on. I mean, sometimes I have to laugh when they'll go, "Oh, look at that." And I'll go, I can't see it. But in general, having someone that you can count on to help you, I think, is very important.
And I think it does change. My wife has, for her, it's been a change because she is my transportation now. I do take Uber occasionally, but her life has changed because a lot of what she does is transporting me around and keeping me active. So it did change her life and it did change my family. My children, who only live a couple hours away, realized that it's changed us an ability to drive and visit them and do things like that. So it does affect your family and your caregivers also.
It's a lot of changes for anybody to adapt to, and I think that's one thing I just want to emphasize with the information today. And Julie, I know you have a lot of experience in this space from your work leading the Aspect Patient Engagement Program. But just the recognition that when you have a vision loss diagnosis coming, it may impact mental wellness. So what are some of the steps that an individual may take in understanding what the impact to their mental wellness, recognizing that, how can they seek out some support for their own mental wellness?
Well, I think there is a multitude of things that folks can do. I do think that sometimes it's about connecting with the right resources at the right time. So getting training for a white cane, getting, a guide dog, or, getting access to the technology or the magnifier that you can then use and carry on and do the things that you did previously, but maybe do it differently now. And kind of as Diane talked about earlier, that balance, refinding, finding that balance again in life. I think that's really important. Sometimes it just is about connecting to the resources. And I also believe that the community is a huge piece of well-being here. Meeting people who are maybe a little bit further along in their journey than you are, who can offer hope again, because sometimes hope is lost, at least for a period of time. And so if they can provide some guidance, along, that support along with resources is incredibly impactful. And for others, it might be individual counseling, and for other people, it might be support group. I think the benefit of individual counseling is, really having that carved out time on a regular schedule to share with somebody who's trained to help you and offer perspective and reframe things. I think there are certainly more we can be doing to sensitize mental health providers on working with visually impaired and blind individuals. But I think as much as you can, help your therapist understand, your condition and what you might need. So a little bit of self-advocacy, I think it can be an incredible relationship, and that can be really impactful for a lot of people to bring them through a really difficult time, that period of transitioning, adjusting and integrating this new identity into their lives. And, I recommend for caregivers and partners as well. Diane, I see your hand is raised.
There's something that's really important I wanted to share. Through Prevent Blindness, I became part of a program called Eye to Eye. When I met with someone once a week, she called me every week and she just listened. She had visual issues as well, and that really helped me. And I just want to say, being part of a group has pulled me out of some dark times, and I've been so appreciative of it.
I think to add to that, one of the things I've found is being able to reach out to others that have similar or more severe vision problems, and being able to help someone else helps you get a little more perspective on your own situation. And it really helps you to know that you're helping someone else.
And along the lines of helping somebody else, I do think through the Aspect program, a focus on advocacy, that's the unifying factor among everyone who joins, is this desire to help other people, to maybe not go through what they went through, or not go through it as long as they did, or to get help earlier. So there becomes this larger mission of really altruism, trying to make meaning from what you're going through and helping others.
Thank you for that. Those wise words. What I heard there is that as your vision world is changing, there's a whole world that wants to help you find a new vision. So reach out, ask for help, and there's a lot of people that want to support you. As we come to our final minutes here, I'm going to do a little round robin to see if there's any other wishes or words of thought that you may want to give individuals as they're getting their diagnoses new, or trying to make adjustments in their life to living with GA. So I'll start with you, Dr. Kitchens.
Yeah, I really love the fact that Pete and Diane were vulnerable and talked about some of the real ways that this can impact you and how you can feel very alone with this condition. And it can be a very frightening condition because you don't know how it's going to progress. I think early recognition and understanding what treatments can bring to you, and engaging your doctor are all really important things.
Thank you. Diane, how about you? What are your parting words of wisdom?
My parting words of wisdom are that it's okay to grieve. I have a little picture on my refrigerator that says, you can't prevent the bird of sorrow from flying over your head, but you can prevent it from building a nest in your hair. And it's okay to grieve and to deal with what you're going through, and then get up and get going.
Dust yourself off and keep going. I love it. Pete, how
And I
about
think a
you?
lot of people have taken the first step by listening to this webinar. It's getting out and listening and finding opportunities and learning. I learned from Dr. Kitchens, and I thought I'd studied this for the last 2.5 years, and I learned tonight. So keep studying, keep learning, meeting other people, and share what you learn with others.
Thank you. Julie, any parting words from you?
I would just say I would encourage you to prioritize your mental health equally to your physical health, and addressing your eye condition, that they are equally important, and that it can make a big difference.
Thank you. Thank you all for Pete and Diane for your vulnerability. As Dr. Kitchen says, that goes a long way in helping others. So thank you for sharing your stories and your experiences. Dr. Kitchens, thank you for sharing your wisdom, even for the most learned. You gave some interesting and new information. And Julie, thank you for guiding us in the conversation and pointing us towards advocacy and mental wellness. I hope all of you found something useful in tonight's presentation. I know there's a lot of resources to get through. You guys gave some great recommendations. And as always, keep learning and keep coming back to Prevent Blindness for more information. Thank you all, and have a good evening.
Thank you.
Thank you.
Thank you for doing this.
Thank you.
Thank you.